Okay, so this competency will deal with applying topical anesthetic to the various sites throughout the mouth. We will begin with the posterior superior alveolar nerve.
Posterior superior alveolar, you want to bring your cotton applicator tip, bring it in beside, right parallel to the 7, okay, and you want to bring the cotton applicator tip parallel to the occlusal plane, okay, then you want to bring it down 45 degrees to the occlusal plane and out 45 degrees, and that should be the spot, right up high in the mucobuccal fold, opposite the roots of the 7.
So Maureen will
So I'm in the
demonstrate
right
that
spot.
one more time.
So you bring your cotton tip applicator in, take it level or parallel to the occlusal plane, bring it down 45 degrees and out 45 degrees, and you should be in the spot, right there. And you want to hold it there for a couple minutes.
The cotton tip applicator will be held in position for 1 to 2 minutes. The duration time of the topical anesthetic will be 15 minutes, okay? But then we're going to move now to the middle superior alveolar nerve, and we should be drying the tissue with a 2x2 cotton first, and then applying your cotton tip applicator with a small amount of topical anesthetic to it to the site of the middle superior alveolar nerve, which is
Just between the 4 and the 5 usually. Now Karen doesn't have a 1-5, so what I felt for is her zygomatic arch, and right in front of the zygomatic arch, you're going to place your cotton tip applicator straight up and down, and you've got the spot.
we'll now move to the anterior superior alveolar nerve, which will involve the teeth from the 1-3 to the 3-3 on either side. At this particular point, we're going to insert it in the first quadrant, and the landmark here would be
It's anterior, or right in front of what we call the canine eminence. So if you look at Karen's 1-3, above you'll feel a very prominent bone. You bring your cotton tip applicator right in front of that bone, feel it with your finger, feel in, and you want to bring it in on an angle just below, right in front of the canine eminence, and you're angling it this way, right at the top of the canine, right
And
in
you'll
front of
see
that eminence,
how important it is to retract that upper lip so that you get it right into the soft tissue
right here.
in that mucobuccal fold and not on the bone. Excellent.
Okay.
Okay, and that completes the 3 areas. The exact same areas would be on the left-hand side of the maxillary arch. We are now going to go to the lingual aspect of the maxillary arch, and we're going to then anesthetize the greater palatine.
Okay, I'm going to have Karen turn toward me, okay, and just
Watch your
open,
head.
Karen, and I'm going to dry the area. Okay, this one I'm a little sketchy on. Okay, we're going to look for, there's a little depression. You know what, we don't have to redo this one.
Yeah, no, we're not run. No, that's
Okay,
good.
you look back for the depression just opposite the 7 on the lingual. I can see hers, I can feel it between the soft palate and the hard palate. There's a small depression. When you look in, and you can feel it there. I can have Karen turn away to do the other side. I can see the depression from here. You come in from the canine on an angle, and it should take you right to the spot, right there. Feel between the 7, or I'm sorry, between the hard palate and the soft palate. Take it opposite the opposite canine, and I'm right on the spot, right there.
And the final area for the maxillary arch would be the incisive papilla, or along the lateral portion of the incisive papilla.
Okay, and just tilt your chin, have your client tilt their chin up for you. Okay, bring your light down so you can see it. Okay, you may even want to use your mirror. Okay, and you can see her incisive papilla is quite pronounced. So you're going to go on the side of the incisive papilla. So you're going to take your opposite index finger of your opposite hand. Okay, you're going to push into the incisive papilla and put pressure on your cotton tip applicator with your finger, because this is more of a pressure anesthetic as opposed to the topical.
Excellent.
Okay, so it's coming in on an angle and pushing.
So again, it's on the
little
lateral
pressure.
portion of that incisive papilla. So along the side of that incisive papilla.
Can you feel that, Karen?
Yeah. And
You
just
feel
the
a little?
pressure of that will cause some anesthetic to
Anesthetic.
happen in that particular area.
That's right.
So those are the sites that we'll be expecting you to
For the
demonstrate in the maxilla. We're now going to move to the mandible
So I'm gonna
and
change
do the sites in the mandible. We're going to start on the mandible with the inferior alveolar nerve injection or block. And if you come from the opposite arch, you'll see how your cotton tip applicator will fall right into a little pouch of tissue right behind the retromolar pad of the last molar. So you want to come from the opposite arch, about the canine of the opposite arch.
Okay, your two landmarks here are your external oblique ridge. You can feel that with your finger. It's a big, strong muscle along here. And the internal is on the lingual side.
No, this one.
If you look from the canine on the other side, what you'll see is an upside down triangle.
You can just see better. That's
And it's a
better.
little bit of soft tissue in the pouch, and that's exactly where you put your cotton tip applicator. So take it in, and it's placed right in that upside down triangle, and that's your spot. And rest it.
And again, right in the soft tissue of that.
Yes, right in that area. There's like a little pocket, as Vera said, and it looks like an upside down triangle. It's right
So that's
there.
for the inferior alveolar nerve. Along with that, the dentist will probably administer the long buccal.
Okay, and the long buccal is just in the soft tissue opposite the 7. Okay, so opposite the 3-7, I'm just going to place it in the cheek side, in that soft tissue, just about 1 centimeter above the occlusal plane, in the soft stuff.
Just drop the hat.
Right there. Can you see that, Lacey? Right in there. Or I
Put a
could
little
do it on
wider,
this
Karen.
side
Yeah,
too.
turn
Bring
that
this side,
side.
turn toward me, Karen. And I can show you, right here, in that soft, about 1 centimeter above
There it is, yeah.
the occlusal plane, right in there.
Okay, perfect.
Okay, good.
And the final one on the mandible would be the mental. Okay. And the mental foramen is usually located approximately between the two
Premolars.
premolars.
Yeah.
And you'll see once the cotton tip applicator is in place, it'll be in line upright, okay, with the
Intercanthus of the eye, or the
intercanthus
inner,
and
the
the
corner
ala
of
of
the
the
eye.
nose, yep.
Yeah, so it comes up here. Straight up and down. Now Karen, again, doesn't have her both premolars, so again, I'm gonna use these other landmarks to place my cotton tip applicator, which is again,
So you'll
the
see.
intercanthus of the eye and the ala of the nose.
And that completes all the landmarks for topical anesthetic application.